FaceRehab podcast series.
Welcome to FaceRehab, the Facial Palsy Road to Recovery. I'm your host, Veronika, and I'm excited to introduce our guest, Dr. Ivana Vyrvova, ENT doctor, facial specialist from Vienna, with extensive experience in diagnosing and treating patients with facial palsy. In today's episode, we'll be discussing everything you need to know about facial palsy, how it's categorized, and how it can impact a person's daily life. We'll also dive into treatment options and recovery. With Dr. Ivana's expertise, we are sure to gain valuable insights and knowledge on this important topic.
Facial Palsy. Road to Recovery.
Welcome, Dr. Ivana, and thank you for joining us today.
Thank you for having me, Veronika. I'm really excited to be part of this initiative to help patients with facial palsy.
I am excited as well. But before we begin, I would like to mention that this podcast is supported by FaceRehab, a mobile application that allows users to scan facial asymmetry, track progress, provide interactive facial exercise and training plan. Download the app or visit FaceRehab.com for more information. So, Dr. Vyrvova, let's start with the basics. Can you give our listeners a detailed overview of what facial palsy is and what causes it?
Sure, Veronika. Let me explain it in simpler terms. Facial palsy is a condition where one side of your face becomes weak or paralyzed, usually due to damage to the facial nerve. There are different reasons why this can happen, such as infections, injuries, tumors, or even pregnancy. The most common type is Bell's palsy, and its exact cause remains uncertain, but it may be related to specific viruses like the reactivation of herpes simplex virus type 1. Occasionally, we can determine the precise cause, even after conducting many tests.
So, based on what you said, facial palsy can be caused by a variety of factors. But we also know that there are different types of this condition. Please, can you tell us more about how doctors categorize facial palsy?
Yes, I can. Facial palsy can be classified based on its duration into 3 categories: acute, subacute, and third, chronic. The terms paresis and paralysis are used to describe the severity of the condition. Paresis refers to incomplete weakness, while paralysis refers to complete weakness. Most cases of peripheral facial palsy occur on one side of the face, it means unilaterally, but it's possible for it to affect both sides, bilateral, although this one is rare.
Mm-hmm. So we heard the different terms. You said palsy, paresis, paralysis. Can you clarify to our listeners the difference between them?
Absolutely. To put it simply, first, palsy is a general term for weakness or paralysis, usually due to nerve injury or disease. Paresis, on the other hand, is when a muscle is weak but still able to move. Paralysis means complete loss of muscle function, making movement impossible. Synkinesis happens when one movement unintentionally causes another movement. It occurs mainly due to facial nerve injuries, resulting in problems such as unusual eye closure or mouth movement.
I think many patients have a problem to categorize this. So it's great to learn about the differences between these words. Patients also often wonder which type they have. What to expect during their initial evaluation by a doctor? What kind of information will the doctor need to collect in order to understand the severity of the condition?
When you come to the doctor, as many patients come to my office, with a facial palsy, they will start by looking at your medical history. They will ask you about when the weakness or paralysis started and how severe it is, as well as any other symptoms you may be experiencing, such as hearing loss or dizziness. To assess the impact of the condition on your daily life, the doctor may use a combination of tools, such as clinical exam, photos, videos, or they are asking you about your own experiences.
According to your words, it seems like doctors need to collect a lot of information to properly evaluate facial palsy. In simpler terms, what are some of the most common symptoms that people with facial palsy experience? Can you give us some examples?
Yes, I can. Common symptoms include drooping of the face, difficulty closing the eye on the affected side, difficulty smiling, difficulty showing emotions, asymmetry in the face, difficulty eating, difficulty speaking, and so on. The symptoms can vary depending on the cause and severity of the condition. For example, in the cases of Bell's palsy, the onset of symptoms is sudden and can be accompanied by ear pain in a rush. In contrast, for facial nerve tumors, the symptoms may be gradual and accompanied by a loss of taste or hearing. It's important to note that the facial palsy can have a significant impact on individuals' quality of life.
Yeah, we know that. But it's quite interesting to see how varied the symptoms can be depending on the cause and severity. So how might the symptoms impact the person's daily life and activities? Can you give us some more examples?
Yes. So facial palsy can affect daily activities like communication, like we are speaking right now, eating, and also lead to emotional changes such as self-consciousness, depression, or social isolation. It's important to understand that the facial palsy is not just a physical condition, but it can also have a significant emotional and a social impact on individuals' life.
It's alarming to hear about the impact of only facial palsy can have on someone's quality of life. That sounds really challenging, and I know that for many people it is. Can you explain what the treatment options are available and how they can help?
There are several treatment options available. These include physical therapy to help strengthen the muscles, then medications to help reduce inflammation, and in some cases, surgery to repair or replace the damaged nerve. It is important to get a proper diagnosis and a treatment plan tailored to each individual case. For example, look at this. In the cases of Bell's palsy, antiviral medications and corticosteroids may be prescribed to reduce inflammation and swelling of the facial nerve. There are other cases. For example, facial nerve tumors. Surgery may be the best option to remove the tumor. Physical therapy is also a crucial part of the treatment plan, as it helps to improve muscle strength and function and reduce facial asymmetry. And then there are other therapies, such as Botox injections or selective neuromuscular re-education that may be used to improve function and symmetry.
It's clear that there are many methods for managing facial palsy, but it's also important what causes it. It is also important for patients to consult with therapists and doctors who specialize in this condition. I'm curious, are there any proactive measures that individuals can take to reduce their chances of developing facial palsy?
Unfortunately, there are no specific preventive measures that can be taken to avoid a facial palsy. However, maintaining a healthy lifestyle, managing stress, avoiding viral infections can help lower risk of developing certain causes of facial palsy, such as Bell's palsy. But also important to seek prompt medical attention if you already experience any symptoms, as early treatment can improve the outcome and recovery.
I see. So we need to seek medical attention. Would you be able to provide some examples of what patient can expect in terms of recovery and prognosis? Because the journey is hard and people challenge on this journey. So what they can expect?
Of course, the recovery and prognosis for facial palsy can vary greatly depending on the cause, as I already mentioned, and severity of the condition. Some patients may experience full recovery with treatment, that's great, while there are others, and they may have permanent weakness or asymmetry in the face. However, even in cases where full recovery is not possible, there are still ways to improve function and appearance through treatments such as physical therapy and surgery. I want to say that it's important to work closely with your healthcare provider and facial therapist to set realistic goals and to develop a treatment plan that will work for you. And secondly, it's also important to have a patience, to understand that the recovery is a journey and it takes a time.
That's great to know. Thank you so much, Dr. Ivana. I want to remind our listeners that they can find even more resources and support in FaceRehab mobile app and on our website, FaceRehab.com, where they can also book online video consultation with specialists like Dr. Ivana Vyrvova. Thank you for being with us today.
Thank you for having me, Veronika. And I want to remind our listeners that we are here. We want to help. So don't hesitate to reach out for support.
FaceRehab. FaceRehab. Bring your smile back.
If you enjoyed today's episode, please subscribe to our podcast and leave us a review on your favorite podcast platform. We also invite you to join the Bell's Palsy and Facial Paralysis Support Group by FaceRehab on Facebook, where you can connect with others who are living with facial palsy and share your experiences. Once again, thank you for joining us. Until next time, take care of yourself and remember that you are not alone in your journey to recovery.
Facial Palsy. Facial Palsy. Road to recovery. Road to recovery.